When a patient comes to our office looking for help for their post-prostatectomy incontinence, we like to provide an individualized and personalized approach to care. We're of course going to get a thorough history, know all your previous treatments, whether you've just had a prostatectomy or whether you've had radiation as well, whether you've had previous interventions for incontinence, and then we're going to try to gauge the severity of your leakage through a number of means. We do a pad weight test where we'll actually collect your pads for a few days and weigh them to get the absolute amount of urine you're losing per day. We will do an evaluation called urodynamic testing, which is a way to gauge the function of both your urethral sphincter and your bladder. And oftentimes I'll perform a cystoscopy to get a look inside the urethra to see how well your sphincter may open and close, and also to make sure you don't have any scar tissue within the urethra, and also to evaluate the bladder for any abnormalities. Once we have done the evaluation and we have gauged both the mechanism of your incontinence as well as the severity of your incontinence, we can then recommend the best treatment and the fastest treatment to get you dry. So let's go over what the treatments are for post-prostatectomy male stress incontinence. Initially, after surgery, you may have had severe incontinence, and then, as your urologist probably instructed you, you did Kegel exercises to try to improve the tone of your external sphincter. Over time, hopefully that worked and you got a lot better, but you may have plateaued and are at the best you're going to be at this point. Usually, we wait at least 1 year before we'll recommend any surgical intervention. So during the first year of healing, if you haven't received as much benefit from doing Kegel exercises on your own, we'll recommend that you seek help through a pelvic floor physical therapist. These are people that have extra certification and training in physical therapy, where they can actually help you isolate your pelvic floor muscles and strengthen them appropriately. We can see improvement in patients that have undergone pelvic floor physical therapy, but just like any exercise, you have to continue to do it. If you stop doing it, you're going to lose the benefit that you've seen. So for the right patient that's motivated to get better on their own, we certainly will recommend physical therapy. In patients with really severe incontinence, however, unfortunately, physical therapy really isn't going to be a perfect solution, and in those patients, we might recommend surgery at an earlier date.